Welcome to all the curious minds and the listeners who were actually waiting for the videos and the playlists to come up in the list of the channels. So now I'm going to discuss deeply about pathology or pathophysiology. So today I'm going to start introduction to general pathophysiology. Now we are gonna embrace all the journey of the pathology. Let's dive in more and learn more information how, why, what is it, what the pathology means. So let's dive into the main session without wasting our time. Come. So now let's understand what is pathology. Pathology or pathophysiology is a word which is derived from a Greek word where patho means suffering or a disease and logos means steady. So, in term, we call it as pathology or pathophysiology. Physiology is the functioning of our body. So we meant it as the study of diseases. So this is what called as pathology or pathophysiology. In essence, pathology investigates what goes wrong when health is lost, exploring the causes, mechanisms, and consequences of disease at every level from molecules to organs. So, pathology is not about discussing or understanding about the facts. It also means asking questions to ourselves why, how, and what. This completes the study of pathology. Now, let us discuss about the clinical terms where in term of why, what, how, we mention in clinical terms why as etiology, how as pathogenesis, what as morphology, so what as clinical presentations. So this completes the whole study of the particular disease. Like you always do presentations in the class or in your colleges, whatever it might be, you collect all the things: etiology, pathogenesis, and morphology, and also the clinical presentations, like whatever. This completes the whole study of that particular disease or the particular patient's profile. So now you might be thinking, what is etiology, what is pathogenesis, and what is morphology, all these things. So let me define you very clearly, step by step, and let me make you understand very easily as much as possible. So, etiology is the cause of the disease. So, example, typhoid. I will take the typhoid as the disease. And what is the cause of the typhoid? Like etiological factor or causative organism. What might be the causative organism for typhoid? Obviously, you tell it is a bacterium Salmonella typhi. So this is how you differentiate etiology. So etiology is called as the cause of the disease. So now coming to the pathogenesis, a second term. So what is pathogenesis? It is a mechanism where the time taken for the disease development. So disease is developed. Initially, it won't show any reactions in your body, any symptoms in your body. It has to develop according to the time. If a person is not in any medications, and even if the person has not noticed that particular disease or that particular disorder has really affected the person's body, of course the person has been not noticed. This pathogenesis is called as the period of time taken to the disease development. So how, like, let me explain you through a example. If a person is affected, or like if a person comes to the hospital and he is diagnosed by myocardial infarction or any other thing. He comes with a chest pain like angina or anything, and after the diagnosis you reveal that the person is facing from atherosclerosis. So what is atherosclerosis? You know, it is the deposition of plaque or fat deposition in the arteries, where hypoxia or ischemia has been taken place. So it is mostly not hypoxia, it is ischemia, where it has affected the particular organ, example heart. It has affected a particular spot where the pain is started and also scarring is started. Scarring, and this atherosclerosis will lead to myocardial infarction. So the doctor will take a prevention stunt, angioplasty will be done, everything, all the medical procedures will be done, and then the patient will be given the treatment, and these are the further clinical significances. So these are the further processes. But so how this atherosclerosis has happened? The person diet might be not good. He might be taking more processed food and more oily food. There is very less HDL. I'm extremely sorry. And so increase in LDL or VLDL, also obesity. So all these things are the factors which will improve the effect of atherosclerosis, and one fine day there is a angina in the person's body, and finally he reaches to the hospital with that particular complaint, and finally he is diagnosed with atherosclerosis, which is a bit severe. If it is not treated, it might lead to myocardial infarction. So this is called pathogenesis. So it has taken a lot of time. So this time interval where the person has eaten or consumed lot of unprocessed food and unhealthy foods. So this is the time interval where the atherosclerosis development has takes place. This is called pathogenesis. So now let's come to morphology, one third term of this what I'm discussing right now. So what is morphology? A structural changes in the cell or a tissue. This is very simple. Let me take the same example of myocardial infarction where the patient is facing this. So as you know, the person is detected by atherosclerosis and there is no appropriate blood flow. Obviously, if there is a blockage in the blood flow, there is no flow of nutrients, oxygen, anything, and this condition had led to ischemia. So ischemia has caused depriving oxygen for the particular part of the organ, and that tissue has been dead. So the death of the tissue is also called as necrosis. So this cell death or cell injury has been takes place in that particular part, and scarring will happen. It is not a healthy tissue and it cannot regain. It won't be regained. It is not cell adaptation. It is a cell injury. The adaptability has completely lost, and finally the cell death has takes place. So this is due to ischemia. This is actually the structural change in the cell or the tissue when there is no oxygen supply, nutrient supply, blood flow for the particular part of the organ. Obviously there is a tissue scarring takes place in the part of the tissue. So now we got to know all the general facts about pathology. Also, I want to tell you that pathology is a main topic which is consisted of several subdivisions. So now I'm discussing the subdivisions of the pathology, where it is divided into many similar short small categories. Now, in pathology, there is general pathology, systemic pathology, hematology, cytopathology, hematology, immunopathology, chemical pathology, molecular pathology, and forensic pathology. So these are the very, very basic and minute subcategories of pathology. So why is pathology so important in medicine? Pathology acts like a bridge between the science and the clinical medicine. So there lies a difference. So this pathology acts as the bridge between the science and the clinical medicines. So as I told you, I'm gonna tell you in brief about all the subcategories in the pathology. So now let me first discuss with you about the general pathology. So in general pathology, we deal about the common effect where it affects all the diseases. For example, cell injury, cell adaptations, inflammation, repair, environmental factors, and also the genetic diseases. So these are the very much most common effect for the diseases. And for example, let me give you an example for diabetes. So let me tell you if what is the general pathology. Of course, diabetes is a genetic, also a environmental affected disorder. If you ask me how, type 1 diabetes is a autoimmune disease. Also, it runs through the genetic predispositions and environmental factors due to the consumption of unhealthy food or processed food for a very long time and not concentrating on the balanced diet. It causes diabetes, and the beta cells in the pancreas are damaged as early as possible, and this causes diabetes in the particular person. So now let us discuss about the second subcategory, which is systemic pathology. How do you describe the systemic pathology? It, like, system means a particular organs are involved. If I'm discussing about myocardial infarction, you know that I'm discussing about the cardiac, isn't it? It is heart. So if I'm discussing about any peptic ulcer, you know that I'm discussing about gastrointestinal tract. And if you are discussing about any chronic kidney disorder, and you know you're discussing about kidneys, similarly, so any systemic pathology deals with the particular organs where there is disorder related with those particular organs for a person. So this in simple I have explained you what is systemic pathology. And now third category is histopathology. So, histopathology, divide the word histo and pathology. Histo, it is tissue. Obviously, histopathology means the diseased tissue is being studied under the microscope. So, to identify more relevant morphological things, or what is the pathogenesis and how, why, what. I have told you before, this significance word, how, why, and what, it is a main most important significant words while you are describing a disease. So histopathology is nothing but the diseased tissues are studied under the microscope. So next subcategory comes with cytopathology, where cyto is a individual cell. Pathology, of course, it is the diseased cells studied particularly by extracting them from exfoliations or any other techniques, where to identify what the genetic protein disorders has been taken place, or any alterations in the gene might have been taken place in the cell. So to study this, cytopathology is studied. Next comes the immunopathology, study of immune system disorder. Very simple. You know many autoimmune disorders, Hashimoto's disease and Alzheimer's. Also, autoimmune disease like type 1 diabetes also come under the autoimmune disease. So all these things come under immunopathology. And next comes the molecular pathology. This is a very crucial study from the molecular level, where you can identify any genetical disorders or any genetic alteration, sorry, also called as gene alterations, where it is caused due to environmental effects also, or UV exposures. All these factors come under molecular pathology. And at last comes the forensic pathology, where you know what is forensic. Of course, very many people are very interested. Oh my god, investigations goes on. How the investigations goes on? This pathology is the legal investigation. This is also called legally. They are investigating if any crime cases has been done in a particular place. They legally go to the spot and they collect few samples, like example hair, nails, or any tissues found, or any human suspect has been found. Of course, they do run a test very much legally under some conditions or rules from the government, and that is how they suspect the crime or criminal, and finally it has been judged in every steps in the government. So we just don't need to discuss too much about that. So this is called as forensic pathology.